it's one thing that we are so, and then one thing that you are seeing it's in our case that if you see as you said that you told me that you read the malaria paper, that's the natural antibodies that we were working in the effect in malaria, and then what you see it in there is actually while our immune system is maturing, meaning that the microbiota is also developing and then they are producing some antibodies. It's called the natural antibodies. So those are in the early life. It's really important until you get a certain type of bacteria or certain type of bacteria to be in your gut to function in a fully way. So then in a way, the immune system and the microbiota goes down together. So I don't know which one comes first, but I think that you need to have them both at the same time. At least the microbiota should come together and then allowing you to the antigens of your host and then recognize them, and then you don't have any effect in later time. So what happens if you don't have the microbiota? So that's, I guess, is the most important thing. So in early life, if you don't have a proper microbiota, then it's like in the later stage what we see now, all the disease that today what we call it the modern disease, like the diabetes, obesity, asthma, no, those are all microbiota related, and some of them are not is dependent on that some antigen that we don't see in an early life. And as in the later stage, the disease is coming. So this is really broad the question, the answer to your question. So we can go always in detail, but let's see all of your questions. So then if you want, we can come back to this one again and we can discuss in detail if that's okay with you.
Okay,
Yeah.
thank you. The next question is there any relationship between the production of pro-inflammatory cytokines elicited by microorganisms present in the microbiota and the incidence of gestational diabetes, and how does this condition influence this process?
Mhm. So that's, I will say, we should skip it because that's not really my topic. So the gestational diabetes. So it's more specific to the people that they work in the field. So I really don't want to say anything wrong on that. So because it's like it's not my specialty. So we can talk about the immune system, but like this is really like out of my subject. If that's okay, if you can get an answer, if you really want an answer for that, I can ask to my colleagues also that I have in the lab. In our lab, there are some of my colleagues works on that, but this is really like out of my scope that where I can help you with.
Okay, don't worry about it. And the third question is a bit alike the other, but if you if you like, we could pass to another. It says, could early alterations in the maternal immune system and microbiome be a
Mhm.
main factor in the development of autism spectrum disorders or other mental spectrum disorders? And what
Mhm.
implication would this have for the treatment of these disorders in humans through modulation of the microbiome?
You really go one specific thing, the autism. So it's like it's really how you call it, it's still debatable question. Also, that's really the main study with the gut microbiota where you connect to the autism. It comes from the Sarkis-Mazmanian studies. So most probably you are familiar with that also. If you have this question, so you saw the study somewhere there. So what they show it in that study is actually we are not still just keep in mind we are not talking about the early life and maternal microbiota. No, so they're just a study to tell you what is telling with microbiota how they affect. So they found one bacteria called B. fragilis. It's really important and then in the later study that they showed that actually specific the polysaccharide from this B. fragilis is really important in the autistic mouse model at least. They were able to revert the phenotype. So if you don't have a proper microbiota, if you provided this bacteria in the system, so you can convert it, you can correct it almost like a 10 or 12 hour of different autistic behavior that mouse shows that you can revert it and they can be the normal mouse. So this is really is the like is really I think it's a, it's a really important study and now it's ongoing in the Sarkis Mazmanian most is following on this study. But the problem is it's really debatable study. And then what you are asking to connect it to the early life, of course, if we go from the same perspective, we can say that if the mother microbiota it's not mature, so if it doesn't have the proper microbiota, then the kids will not get it with the naturally born kids, so they will not get the same microbiota, so there will be lack of this bacteria. And but from the immune system part of the mother, I think is not so big deal. So that you get still the proper immune the antibodies from the mother milk, so that which I mentioned you actually before your colleagues joined, so that's the early life affecting for your health. But is an autistic mouse model that is what they show is really specific bacteria to have them that's inducing all the antigens related antibody responses, and then it's producing this protection. We cannot call it protection, actually. Autism is a completely different model. So it's really difficult to argue. Yeah, they show that there's a bacteria effect. So I am just making an assumption so that we work in the lab early life microbiota, but not autistic mouse model, no. And it's really difficult to connect it in there. But what I can tell you, if that's really true, if this is really the one of the bacteria that affecting the to having the autism, at least in the mouse model, what they show. And if this is missing in the early life on in the mouse, that's the phenotype that we will expect to see it maybe eventually in that. But keep in mind, in mouse to do that things, they need to inject a poly-IC. So it's like one of the chemical that they induce this model, no? So it's not like just because you don't have the bacteria that you have the immune system, that you have the autistic mouse model, no? So this bacteria is just helping you to convert it, to revert the phenotype that the autistic mouse model you generated, you give this bacteria, boom, it's getting better. That's what they show it. But missing this bacteria doesn't mean that it will happen the same thing. So it's like because there is a bacterial redundancy that they call it. So you can have the bacteria A, I can have the bacteria B. They're completely different, but they can functionally do the same job in the host so that they can compensate each other. So we can have the same metabolic function. In that sense, I think the autistic, at least the autistic model to study with the bacteria, it's a bit still we are not immature in the same level, I will say. But keep in mind, again, this is really one specific niche that you are asking the question. That is like I'm almost like you based on what I read or what I see from the conferences from the Sarkis Mazmanian, I can speculate it. But study itself is a speculative study, no? So that is really we should be careful with what we are saying on this study.
Next question is, could human-induced horizontal gene transfer, example CRISPR-Cas, be used as a strategy to inactivate antibiotic-resistant genes in bacteria present in humans exposed to low levels of antibiotic in the environment? And how could this intervention influence the dynamics of microbial resistance and the stability of microbial ecosystem in clinical context?
Mhm. That's also like I don't know. So it's like it's another thing that I can speculate, no? So as I said, like it's not really my studies, this type of things. It's a pioneer thing that with the CRISPR-Cas you can do a lot of stuff. So it's most probably it will work. And then but it's still I'm not aware of any study if they really look at it in this context, if it's really going to the effect. I think that's so you should keep in mind is the microbiota is like the not the CRISPR-Cas, but now, for example, there are the phage therapies that's at least that if I just try to make it a similar connection and then telling you for the IBD patients, so that's what we are like we were trying to help to some studies like with the phage therapy, so where you can target a different part of the bacteria and then you can reduce it, and then maybe in the same context for the antibiotic resistance bacteria you can use it so to target the resistant bacterias with a known gene so that because we can annotate them, no? So that's really easy to annotate to find when you do the shotgun metagenomics, you can know the whole the genome, you know the gene content, and then you can target those specific bacteria with the phage, and then you can kill them. So, but I'm just going from the same line that the CRISPR-Cas should work the same thing. But as I said, so this is like it's almost like the diabetes question that you asked. So it's really out of my scope in the field that I'm working it. So I cannot really speculate it so much also.
Okay. And the last question is, has the microbiota acquired during birth, whether through vaginal canal or by cesarean section, influence
Mhm.
the long-term development of immune system, and what differences in microbial composition could explain a greater predisposition to immunological or metabolic disease depending on
Mhm.
the type of birth?
Hmm. So this is almost like a class. We do it in here. We give it the class about these subjects, I can tell you. And that's like your final question is almost like my like our lab, what is it working on it, like rather than the other. So I can give you a hint about this a bit. So the babies, if you read the study, so there will be some studies that are saying that the babies are not completely sterile, but that there is one Nature paper from maybe 2, 3 years ago, I'm not sure, but it's in after the 2020 at least is published. So it shows that there is no bacteria in the babies. They born sterile. Okay. So that's what we know it also from the mouse. So when we transfer to the germ-free, they are sterile. So that you take from the mother's womb, you put them to the other pregnant mom in the germ-free facility, and the mice is germ-free. There are some cases where the babies they claim that there are some bacteria because these are the premature babies, so that maybe the stress and something happens and then they can have some bacteria. But let's focus on that the babies are completely naturally born. So when you're C-section born, so basically what they do know, they cut the mother's belly and they took the baby out. So the first thing that the baby exposed is the bacteria from the gloves, from the environment. So then you cover it with the towel and everything. They are clean in a way, they are sterile maybe in a way, but then you are in an environment, then you start to get from the hospital. So that if you check the microbiota of the babies in the first couple of days, it's like the hospital bacteria that they got it. And then from the mother, if they do the vaginal born, and that's the time that the mother, after they come to the third trimester, they start to have more lactobacillus bifidobacterium bacteria, so those are important for the digestions of the milk. And these are in the vaginal microbiota is also their population is increasing. I mean it's shifting to the one direction to have it more the lactobacillus and bifidobacterium, this type of bacteria that can be helpful for the digestion and help to the baby in the first place. And through the birth, that's the like a natural colonization of the baby. So they got from the vaginal microbiota all the bacteria. And that doesn't finish in there. So that we were thinking that it's finishing in there. But when the babies they start to breastfeed, so you start to get from the skin, from the mother's skin, so that you also get from the mother is while breastfeeding a skin to skin interaction. They got the skin microbiota from there. And inside of the mother milk, there are bacteria which are really important for the health. So they don't get only nutrients, they got the immune cells, no, not immune cells, they got the antibodies, and then they get the bacteria. So that's allowing them. So what's happening? So you start to get the microbiota, the healthy one from the mom, and you get it through the vaginal microbiota in the beginning. And your microbiota start to evolve slowly with the environment. So it's changing, maturing, getting richer. But at the same time, your immune system is still not mature. To be protected, you need the mother milk, and mother milk is bringing not only the bacteria, this time is bringing also the antibodies. It's helping you to be protected from some diseases in early life until your immune system and your gut microbiota mature. So this is called one of my colleagues also actually two of my colleagues in the lab they work with on this concept in early life and the windows of opportunity. So that's the time frame that it's called where it's really critical time in the life of a baby. So if you miss that time period where the immune system is really trained by the microbiota, then in a later stage that you have all the metabolic diseases, as in the beginning I told you like that we have all this obesity, I don't know, like the diabetes, and this type of all metabolic type of diseases are occurring in the later stage, no? So that those are the asthma, no? This type of things, they all today we call it like a modern life diseases, so which they were all missing in an old time. So in that sense, if you think that that's the reason why the mother milk and natural birth is really important. In an old time, I mean, like in an old time, 10, 20 years ago, maybe they were always promoting for the mother health, they were promoting to do the C-section, but now everything is going back and then they are saying, no, no, you should make a normal vaginal birth if it's possible, if it's not dangerous for the mother, because then the baby will chance to get more healthy microbiota. It's really important, and that's like the critical window of opportunity that is caused in an early lifetime. That's a lot of diseases now they start to connect it to microbiota. Of course, still we are in a level to understand which ones are important for the development of the babies and then how it's affecting in a later stage. But at this stage, at least some of them are really shown that how can affect metabolic in the later stage if your immune system is not trained by the specific bacteria in the early life. So this is almost like a summary. So for those of that you're interested eventually, I mean, there are really good, like the books, like one of them is the from the Martin Blazer life. The Martin Blazer when he was in the so in NYU he write a book about like the it's called Missing Microbes. So it's about the antibiotics effects. Actually, that's another thing that in early life like in the first 2 years of your life, if you use the antibiotic, if the babies use a lot of the antibiotic, the microbiota is always changing, and that's affecting in the later stage. And then they show that how is affecting the obesity. So these are like a 2013, 14, 15, and those years he published a paper. But then for those of you that doesn't want to read like too much the scientific things, you can read this popular science book where he describes in early life if you interrupt the microbiota, like with the antibiotic, that can lead to a later stage in a different diseases. That's a really good example also.
Yeah, I get it.
Yeah.
No, well, that was all the questions we had. We
Mhm.
thank you for accepting to answer our questions.